Hello, friends and colleagues. It's Greg Shaw from the International Federation on Ageing, IFA. It's been 7 days since I last spoke to you. Today I want to talk about COVID-19, long-term care, and issues around returning staff into the long-term care infrastructure. You've got to ask the question if governments across the globe are getting it right in the efforts to mitigate COVID-19. As an Australian living in Canada for the past 18 years, the difference between the two countries couldn't be more stark. Australia, confirmed cases, 6,500. Recovered, 3,750, or about 58% of those confirmed cases. Deaths, 63. Canada, confirmed cases, 28,380. Recovered, nearly 9,000, or about 32% of those cases. Deaths, a little over 1,000. Yes, I know there's a difference between population sizes, but if we take this into account, for Canada the calculation would be confirmed cases 18,700, recovered nearly 6,000, and deaths 665. I also know that there is a variation in testing rates between the two countries. Australia, its rate is 14.65 per 1,000 people. Canada's testing rate is 12.3 per 1,000 people. And we know that testing is our window into the pandemic and how it is spreading. Without testing, we have no way of understanding the pandemic, and neither country is testing anywhere enough. However, Australia must be doing something right with only 63 deaths. In terms of long-term care in Canada, what COVID-19 has revealed is a system that is broken and a building infrastructure that cannot even mitigate outbreaks of influenza, let alone COVID-19. In some cases, 2 to 4 residents in one room, a shared shower, bathroom for up to 25 residents, and even where there are single rooms, these often have a shared washroom, which means no shower or bath facility, for 2 residents. Building standards must be updated to single rooms with en-suites if we are to provide the safety, dignity, and care that our older people deserve. Interestingly, this has been the standard in Australia for over 30 years. Canadian government should be closing all Class B and C homes as a matter of priority and making available the capital to build long-term care homes that can provide safe environments for both residents and staff. I want to acknowledge the care workers in homes across the globe for the dedication and commitment you have in supporting our older people who are some of the most vulnerable in our populations. Finally, I want to suggest a long-term care returning staff guide that exemplifies good practice. We should have this in Ontario and across Canada. After a confirmed case of COVID-19 and self-isolation, employees who have had COVID-19 and recovered can and should return to work. A confirmed case can be released from isolation if they meet the following criteria. The person has been fever-free for at least 48 hours, resolution of the acute illness for the previous 24 hours, be at least 7 days after the onset of the acute illness, and finally, be PCR negative on at least 2 consecutive respiratory specimens collected 24 hours apart after the acute illness has been resolved. This is the returning staff guide that really does exemplify good practice, and a practice that needs to be adopted across all health agencies and provinces in Canada. Thank you, and I will update you again next week on some new thoughts and comments.